Hello, can you hear me now?
Yes, sir, I can hear you now.
All right, perfect. Well,
Can we try sharing your slides, sir?
good thing we decided to do this test to make sure everything's under control.
Okay, sir. Can we try sharing your slides? So I will be passing the presenter controls to you, and please try.
Uh, okay, sure. Okay, so I can share my slides from here, right?
Yes.
Is it through a simple screen share?
Yes. You
Uh,
just have to click the show my screen and then pull out your slides. Just
okay,
have to
so
put
I'm
it in
just
full
opening
show.
them here. Um, okay, just fixing something very quickly. Can open the slides. Okay, so has it shared yet?
It's not yet loading on my side. Have you clicked the show my screen button before?
Are you not able to see it? Okay. Well, let's just change presenter, show screen. No. I think this has started the broadcast.
Yes, but I can't
Are,
see your screen yet, sir. There.
uh, are you able
It's
to see
loading
it now?
now. Yes. Will you be presenting with Dr. Alessandro tonight?
Uh,
Is he with you?
yes. He's here with me. I'm joining him just now.
So you're in one room?
Yes, we are. Yes, we're together.
Oh,
In one
okay.
room. Yeah.
Okay, so we will be starting the webinar in 5 minutes.
Okay.
Right, thank you.
Sure. Great. Thanks. The screen is visible on your side. The slides are moving. Are you able to see everything?
Yes.
Okay. Perfect.
All right, thank you.
All right. Thank you. Dois, cinco minutos.
Está muito. O único problema é quem queria trabalhar comigo.
Ok. Mas também, se quiseres, pode entrar no sistema e ir escutando enquanto eu apresento num outro lugar. E depois.
Não. Fica aqui. Não tens o. Ok, eu vou ver aqui. Eu esperava que o Ivan. Onde está? Temos um problema sério comigo. E a gaja continua a dizer que nós temos que fazer o badge da maneira que ela quer. Mas o Ecor quer outra. Ivan,
Essa
Good evening, everyone. Thank you for joining tonight's webinar. Please be reminded that all microphones are muted throughout the meeting. And for comments, please use the chat box. And for questions, please use the questions box. Maybe now call on our speakers for their presentation.
Yes. Hello. Antonio Mashev from Gembi Health Systems here. And I'm here along with Dr. Alessandro Campione, who's our programs director. May I proceed with the presentation?
Yes, please go ahead, sir. Thank you.
Okay, thank you. So good evening and good afternoon from wherever you are in the world. We are based in Cape Town, which is our headquarters office. And thank you all for participating in this call, where we're going to be talking about the implementation of health information systems in Mozambique and our model of cooperation and technical interventions with Mozambique institutions. First, I will start with the three W's of Gembi, which is the who, the what, and the why. And first and foremost, we're an African not-for-profit organization based in South Africa with satellite offices and country programs in different countries around Africa, mainly Rwanda, Mozambique, and Zambia. We also have some regional programs as well, and some projects across the continent. And we have a total of about 93 staff currently. That's composed of health information system specialists, epidemiologists, developers, business analysts, statisticians, program managers, IT technicians, and the list goes on, covering all specialties required for not only the development, but as well as the implementation and follow-up when it comes to the deployment of information systems in a given country. What we do is we design, develop, and implement information systems. It's not only information systems in the health sector, but it's also in the gender, children, and social affairs ministry, for instance, in Mozambique. And we work as well with ministries of justice across the continent in the area of civil registration and vital statistics. We also provide technical skills and implementation expertise to a various number of institutions and nonprofit organizations, including institutions within the public, private, and academic sectors. It's mainly support to the public and academic sectors, but we also collaborate with the private sector as well. And we manage and coordinate collaborative networks of organizations and specialists within our scope of work. And we also have a strong research component into the application of the right health information systems for developing countries, meaning that we look at researching the best possible solutions considering local context, as well as sharing experiences and knowledge on our implementations through symposiums, webinars, and academic publications. And now, why we do what we do? Well, there's an obvious increased need for evidence-based decision-making by health authorities and authorities in different sectors, like, Ministry of Justice and the social welfare sector. And so not only we develop the technology, but we help in the area of data collection, data use, data analysis, to make sure that data collected from the information systems developed is also used and contribute towards policy and M&E and national planning and that has been the case. And I'll speak a little more extensively about specific systems that we've implemented throughout the presentation. And then obviously we operate as and act as honest brokers throughout the process to ensure we're very big on capacity building and on building teams with local staff to ensure country ownership and leadership over the projects over time, because in a lot of situations, some of the projects may reach an end while there's no local capacity build to continue with the project. And so we're very strong on ensuring country ownership, and so that work is done through refresher training, constant mentorship, on the job training, supervision visits to ensure that the knowledge is retained. And then one of the reasons why we do it, obviously, it's to overcome the difficulties of generating accurate analyses and reports based on reliable information. And then also scarcity of health IT skills and training is one of the reasons why our intervention is deemed to be supportive in such contexts. And then this is a quick list of some of our funders and partners with whom we work and collaborate in country. You can quickly see on this slide. And then this is just a brief visual demonstration of the countries where we operate, as well as the donor community around us that supports our projects. And so, as I mentioned, we have several country programs. For instance, in South Africa, where we have our headquarters and our main office, we also have the South Africa program that contributes towards supporting the National Department of Health in several projects. And one of them is the Mom Connect initiative, a project where we supported in the development of the back end of a mobile app that provides specific health messages for pregnant women. And the success story with Mom Connect is as the project was launched, 500,000 pregnant women registered for the services. And today we have, I think, about 4 million pregnant women and women with young children up to the age of 5 registered into the system receiving this information. And then we have the Blood Safety Strengthening Program, which is responsible for the blood safety information system that's also been deployed in several African countries. One of our flagship projects in South Africa and across Africa is the Open Health Information Exchange Project, which is a platform that allows systems to be integrated and interoperate in various different circumstances using national and international guidelines. So through the Health Information Mediator, which is our interoperability platform, we're able to have several different systems integrated, and that has been very useful, for instance, in cases such as CRVS, where you have different departments registering several vital events and occurrences and need all that information to be streamlined and to be able to be visualized through one dashboard where all the information can be then processed by the proper managers. And then we have the CRVS project, I already mentioned that. We are involved on CRVS in several countries. We also supported the development of the CRVS digitization guidebook. Hearth is another piece of software that we developed. And then we have the Rwanda office, excuse me, that has several projects that were also in support of the ministry of health, including the Health Information Integration Project, the Ministry of Health Data Warehouse based on DHIS2, Rwandan health system strengthening activities where we also participated. Then in Zambia, we're a part of the integrated decision and analytics support project along with USAID and other partners. And then at the regional level, we're supporting the regional bodies in East and West, the regional health bodies in East and West Africa through immunization program support among mobile populations across borders through the Regional Action Through Data program. And then Mozambique, which is more specifically what I'm going to be talking about throughout the webinar. And I will be talking about two projects in particular. We've been involved since 2009 in over 25 projects supporting health informatics, supporting capacity building of health staff, with over 1,500 health staff trained in system use, data collection, analysis, and use. And a lot of the data has been used over time for national planning, and not only at the central level, but as well as to respond to particular PEPFAR indicators or at the provincial level as well. And so some of the systems that come to mind is the National AeHIN system based on DHIS, which is the one I'll be talking about and has already occurred. And then we have the National AeHIN system for the Ministry of Gender, Children, and Social Affairs. We developed mortality registration system. We work with the Ministry of Justice and the Interinstitutional Vital Statistics Working Group on CRVS strengthening, and we're currently working on the rollout of the point of care system across 250 health units in Mozambique. We're under preparation right now for rollout, and we've developed all the requirements that I will be talking about shortly. And several other systems and innovations that have been developed. And that's for country programs. Now, before I get into the implementation of our systems in Mozambique, I think it's worth noting that in a lot of health informatics related projects, the tendency is for developing countries to focus solely on the technology, but we believe for it to be a holistic, to have a holistic approach, whereby the system does not only mean the electronic system or the electronic medical record, but it encompasses a wide array of processes and procedures before we get to implementation and use of the system. And as you can see on this slide, that starts with the identification of the public health problem or clinical problem by a state institution requiring support. And then once that's identified, then what we do is at the first level, we develop tools, or we already have tools developed based on international and national standards, and tools and protocols to conduct assessments, to look at what the gaps are for the specific problem identified. And so, which is the case, for instance, of the rollout of the point of care system, where then we look at what is missing in the system or at the health facility level, if there's a high level of preparedness to accommodate systems, and what are some of the needs. Then once that's done, one of the processes that's usually done in tandem is the whole component of project planning and solidifying the agreement between Jambi and the national institutions that we support. And so that's where our interventions are regulated by MOUs and specific work plans that support the implementation and can be monitored over time. And from that, once it's set up, what happens is that we advance to the phase where we define the requirements, functional and non-functional requirements. And so we have business analysts and system analysts involved within this process. And from there, that's when we get to the development of the system or configuration. Oftentimes, we tend to work with open source platforms because they're very flexible to configure and also easy to adapt to any environment, particularly in developing countries. Once the system is developed, manuals as well are developed within the process, and that's where our team with implementers goes onto the field and installs the systems, they test the systems, they work hand in hand with system users and administrators to make sure that the information is collected and properly analyzed and used adequately. And then we also provide support in terms of M&E, data quality, to ensure that the collection of data is done routinely, and that we really go towards the goal of achieving complete ownership over the system. So we do support the MOH, for instance, in Mozambique. We're supporting them currently for the past 2 years after the system was deployed, in ensuring that data is still gathered routinely and analyzed appropriately, and proper reports are developed. And through our intervention and with our support, these data have contributed to national economic and social plans and other institutional documents related to policy and planning. And so I will talk now about the national implementation of the M&E system based on DHIS2 in Mozambique. Just to give you an understanding first, through a project that has been, if we are to be fair, to a certain degree completed. We're just in the phase where we're providing mentorship and support in data use. But this is just to give you an idea of the processes as well as the impact of such a system. And then I'm going to move on to the implementation of the point of care system, which is an ongoing process that started last year. And so the aim of the SISMA, which is the National M&E System for the health sector currently in Mozambique, is to support the collection, analysis, interpretation, and dissemination of health data used to plan public health across Mozambique. And so the process was as follows. First, we had the evaluation of the older system, look at the forms that are missing, that do not necessarily correspond to the national health programs, and so on and so forth. And then we move to the requirements definition phase and resource mobilization, as well as project management and planning, which are the steps that are previously described, on solidifying our cooperation and make sure that it's regulated by performance agreements, MOUs, and annual work plans. And then that's when we excuse me, proceed to system development as well as the development of manuals for users. And then the installation occurs, the training of trainers, and an official handover of the system to the Ministry of Health. And then the phases that we're currently in for this particular project is maintenance and support. And so we have IT technicians that are also trained in M&E, who are based in Mozambique's different provinces to provide direct support at the district and communal level, meaning at the health facility level, to resolve any errors or bugs on the system, and as well as to provide support and mentorship in system use, as well as M&E and data quality. So that's the phase that we're in with the national M&E system in Mozambique. And so some of the results of this intervention in our technical support in Mozambique, particularly in M&E, is the installation of the system in Mozambique's 161 districts in all of the provinces, the migration of historical data from the former system, Módulo Básico, to the new electronic system, SISMA, the development of additional modules for HIV, nutrition, epidemiological bulletins, mother and child health, and other forms. Through our provision of technical support, we also supported the ministry in the training of 1,092 national health staff in these different components that I've mentioned. And they're all registered in the Human Resources Information System of the Ministry of Health. Today, Mozambique counts with about 2,301 users nationwide of the system. And so as you can see, there's an incongruency between the number of health staff trained and users. And this is partly because a lot of the trainees were trained to build the capacity to other health staff. As I've mentioned previously, statistics discussions are generated informed by data collected from these systems, and as well as reports, and they've contributed also to Mozambique's national and economic plan, and other activities related to national and provincial level planning. And so this is roughly, this just describes the processes that we went through in the implementation of the national M&E system and some of the results. And now I'm going to move on to the system that we are currently working towards implementing, which is the point of care system, as I've mentioned previously. And I'm just going back to the process. In this case, it's slightly different for us in terms of processes, because there are different stakeholders involved. And some of the responsibilities regarding system development, for instance, have been attributed to other partners. And we're more so the implementation arm on this particular project for the rollout in several health facilities throughout the country. And so to this day, what's happened regarding the point of care system is that we've gone through the planning phase, along with all stakeholders involved, including the donor, the Ministry of Health and other clinical partners involved in this particular project, with a clear plan that has been agreed by all parties for the implementation of the system in the coming years, starting this May. And so in this process, what has been done to this point from our side is the definition of hardware requirements, the recruitment plan also for the national rollout. We'll be boosting our team by 25 staff, given that this implementation goes across Mozambique. And so we found the necessity to have more procurement officers, electricians involved, more technical project managers involved in making sure all of the infrastructure is appropriately allocated, and technical staff also to support the provinces, as well as regional project coordinators in all 3 regions of Mozambique for this process. And one of the processes going on right now is the rapid and readiness assessment of all health facilities. We're starting with 52 health facilities for the current year, and then that will be multiplied over time. And so we're looking at the preparedness of all facilities at the moment to be able to accommodate not only the system, but the equipment that's also going to be deployed, servers, cabling, and computers, and all sorts of scanners, and all of the equipment that has been defined for this implementation. And then the installation, which will occur starting this May, and training of trainers, which is a process that I've already mentioned, as far as ensuring that local staff are prepared to use the system over time. And so you have a visual illustration of what the rollout plan. This is a very high level, because then it's broken down into several activities, but this is a high level plan for the rollout of the system, with all stakeholders involved, as I've mentioned previously. And then this is the architecture. This is just an architectural overview on how the system is going to be connected, considering networking, and it's very country specific. Mozambique uses the government network for national systems, which is the GovNet. And so it also shows how the information is going to flow from health facility level to the district up to into the province. And then moving on, and so we just have descriptions of some of the processes that I mentioned previously. So for the rapid assessment, which is currently under performance, the main goal is to obtain quick information to support high-level decision making, and to look at the priorities for installation and procurement plans, as I've explained. And there go the stakeholders who will be involved in the assessments, including the Ministry of Health at the provincial level, health facility staff, clinical partners, as well as our technical team providing support. And it's the same as, for the readiness assessment, but the only difference is that the readiness assessment is going to be more thorough and it will take more days. So we'll look at all the details, including the voltage, sockets, servers, racks, and so to make sure that we respond, to the standard protocol for the implementation of such a system into a health facility. And then the workflow assessment is ongoing. There are scenarios that the Ministry of Health presents in terms of workflows, but we find it important at this moment to look at the workflow in 3 to 4 different health facilities to define an ideal workflow, particularly for the point of care system. And as I've mentioned, the main objective is really to have a standard model of workflow that can be used for several health facilities. And the performers of this assessment include the Ministry of Health at provincial, district level, HIV program managers, and health facility participants will also be there, obviously clinical partners as well as our team. So as you can see, throughout the entire process, we work hand in hand with our implementation partners as well as the Ministry of Health to ensure that we're following all procedures together. And so then we have the definition of the standard infrastructure. Obviously, we've developed much more thorough documents that were circulated among implementing partners in the Ministry of Health and all stakeholders, as well as the donors. But this is just to give you a brief idea of, some of the equipment we're looking at, to support networking, etc. So we look at printers, barcode scanners, modems, inverters, power stabilizers, solar power panels, generators. As you know, Mozambique is a developing country, and the more you move away from urban centers, the more difficult it gets in terms of infrastructure due to limited internet connectivity, and poor physical infrastructure, as well as power supply shortages as well. And so this is a quick summary of some of the equipment that is included within our protocol for infrastructure requirements. And then, after this process, what's going to happen starting May is the deployment of infrastructure. And as you can see on the side, we have a diagram that shows the architecture for the pilot and the different sections where the system is going to be installed, including the reception, the pharmacy, the lab, for the system to function properly. And then that also gives our technical teams an idea of where the workstations are to ensure proper connections in terms of servers, networking, and configuration of all necessary utilities in order for the system to function properly. And again, as stated previously, the working team consists of the ICT department of the Ministry of Health this time around, as well as, and that's from the central level, as well as provincial and district level offices of the Ministry of Health, clinical partners, and ourselves. And then one of the last pieces of involvement, which you've seen also in the deployment of the national M&E system, is the training and help desk support and maintenance aspect, where we have training of trainers as well as follow-up on-the-job training. And in this process, for us is very important to include a change management component, whereby we identify champions of the system within the health facility to make sure that not only knowledge is retained, but that there's interest in using the system, because we can go through all these processes and mobilize resources and implement system, have the right infrastructure, but at the end, the user is the key to collecting these data and analyzing the data appropriately. And so we deem that it's very important that we have training and capacity building activities that also identify these key stakeholders within the health facility, or at the level where the system is installed and at use, to make sure that data is collected routinely and properly analyzed, and statistics come out of that data responding to national indicators, and those also supported by the donor community. And then lastly, we also have help desk support and maintenance, which is the work that we do post-implementation, again, to make sure that knowledge is retained and the system is being used at all times. And so this diagram just gives you a visual understanding of all of the processes that I've just described. From the readiness assessment, it takes about 5 days in each health facility, and then installation of the system, the installation of all of the infrastructure, electric cabling, security, in the environment, which takes about 7 to 14 days. And depending on the size of the health facility, the magnitude of the services, these can range between 7 to 14 days. And then we also have the hardware installation phase. And then afterwards, that's when the system is installed and the staff is trained, and initial support begins. And then the post-implementation phase, as I've mentioned previously, which includes maintenance, supervision, help desk, and emergency support on demand. So thank you very much. I hope the presentation has been insightful. You've gotten an idea of what GEMBI Health System does, but most importantly of some of the procedures that we've been following for the past 10 years in the nationwide implementation of health information systems in low resource settings. So thank you very much. I'm here with Dr. Alessandro Campione, and if you have any questions or anything that you'd like to have clarified, we're very much open to responding. Thank you.
Yes, thank you for that presentation, sir. There is one question from Dr. Fazila. I would like to ask Dr. Fazila if she can use her microphone to ask the question.
Yeah. Hello,
yes, Dr. Fazila, thank you.
Yes. Thank you very much for the presentation, and congratulations. You really have a very structured way of implementing HRS for over the years. I have few questions here. One is the need assessment. You are using some tools and protocols. Is it very specific for Mozambique, or can it be shared with other countries?
Yeah, good afternoon. This is Alessandro Campione. Yes, need assessment. We have protocols, and depending on the type of system we are assessing. For example, I make an example. We have been assessing the system for the civil registration via the statistic. We have been using WHO protocols. In other cases, we have been developing our own protocols and submitted to and together with the Ministry of Health and CDC and other partners, and they have been creating local protocol adapted. for example, in the case of assessment of a health facility, we've been using, again, WHO and all others example, but always adapted to the country in the work done together with the local team. So we tend to use protocol, international recognized protocol, but then we do quite a lot of work to adapt together with the local institution to the local need.
Right. Okay. Great. Oh, sorry, I forgot to introduce myself. I'm Fazila from Ministry of Health Malaysia, and I'm also a General Counsel in AeHIN. Actually, my next question is on the enterprise architecture. Malaysia, we are also having quite a bit of problem in enterprise architecture. So what are the challenges that you have there, and how did you overcome it?
Yeah, that's a difficult question. Many times the bigger problem, if I can be very honest, is not even the part of technology or designing the enterprise architecture or the general architecture of a.
It must be the people, I guess.
So we used to say that interoperability architecture, all these things has to be built first in the mind of the decision maker.
Right.
And this is, in my opinion, in our opinion, is the biggest challenge. To make, yeah, it's a very difficult idea to approach for, especially people that are not used to this concept. So it takes, I would suggest to take time to explain and to bring people into the concept slowly with patience, and not just present complicated concepts here. Because most of the time you find a barrier, and it looks like very complicated, and people will not follow you. So a suggestion we give, and we still have problem many times, is to make sure that there is a training and a support to the people that has to decide into these matters.
Yes. Are you using any specific framework for the enterprise architecture?
Yeah, we have been using some very technical document, but we have seen that are too complicated and too wide and too specific. So we've been creating simplified document and tools to introduce the concept of enterprise architecture, and they have been working better.
Oh, great. Thank you. Is there any other questions?
I think there are no more questions.
Please go ahead.
I think there are no more questions from the participants.
Okay, I have one more, Chia. Sorry.
Okay.
Yeah. What is the timeline you are looking at to cover the 50 over health facilities for that POC EMR that's going to start this May?
Yes, we can only say what has been established by the Ministry of Health and CDC, PEPFAR, which are the main actor. We are trying to satisfy the expectation. Anyway, the first 52 health facility will be covered in a year, which is quite a big challenge. But as my colleague said, we have already a team in the country quite big. It's over 33 people, and we are hiring another 30 people. So it will be 60 people working on that. And then for the next year, every year will be increasing to 100 in 2019 and 150 in 2020. That's the plan. Now we'll tell you in a year time if that was a good plan or not.
Yeah. I can see a huge challenge there, especially in change management.
Yeah,
especially
it's true.
yeah.
But I would say that we are present in the country and in the field quite from a long time. We are also very afraid, and we are trying to imagine the challenge and everything, because we have been installing already in the past in more than 200 sites. But
Right,
yeah,
right.
it would be interesting maybe to have a follow-up meeting in a year time.
Yeah, that'd be great. I have no more questions.
All right, there are also no questions in the questions box, Dr. Fazila. So thank you, Sir Antonio and Dr. Alessandro, as well as Dr. Fazila, for actively doing this discussion, and also to our participants for tuning in the call. So are there any last words from our speakers?
No, just to thank you very much for this opportunity to be able to share some of our experiences. And as I've mentioned, a lot of our projects are designed in a manner that is scalable, and so they can also be reused in similar contexts for developing countries. But other than that, we're very appreciative of this opportunity to share some of our experiences. Thank you.
And also on behalf of AeHIN, I would like to say thank you, and also again congratulations for having such a good structured project planning. Yeah. So hope we will get to do follow up on your implementations in a year or so.
Yes, definitely. Thank you.
Thank you. Thank you.
Thank you.
Thank you again, everyone, and good night.
Good night. Bye.
Right.